Concern for climate change deliberated in RIMS seminar. Regional Institute of Medical Sciences Imphal RIMS organized a one-day seminar on the theme Swachh Bharat, Carbon Suniya Bharat in Imphal on 26 February, where Maharaja Laisimba Sanajoba, MP Rajya Sabha, graced the occasion as chief guest. Professor N. Sanjeev Singh, Medical Superintendent RIMS as President, and Dr. Aditya K. Joshi, Principal Chief Conservator of Forests, Government of Manipur, as well as Professor Poonam Dhunia Singh, Vice Chancellor, Manipur University of Culture, as guest of honor. The event was also followed by the distribution of certificates and cash rewards to the winners of state level painting competition at RIMS painting competition at the RIMS Jubilee Hall on Sunday. Technical speeches were delivered by S. Priyakumar Singh, former Director of Science and Technology of Government of Manipur, Dr. Koijam Mani Bhushan Singh, Associate Professor of and Head Department of Environmental Sciences, DM Professor of Science, DM University of Imphal, Professor Bankim Chandra Oina, Department of Civil Engineering, National Institute of Technology, Manipur, and Dr. Aditya K. Joshi. Maharaja Laisimha has highlighted the government's view of reducing carbon emissions and said that PM's Modi vision is to make a healthy India by making lifestyle changes. He spoke about the concept of reduce, refuse, and recycle and advocated strongly for making lifestyle changes. The MP hopes that the program will bring out lifestyle and insights for the state. He also stated the need for active lifestyle, traditional medicines, waste treatments, energy conservations, paperless facilities, and digital innovations.
Two components underlying the principle of reduce, reuse, and recycle, and they are number one, lowering carbon emission in health facilities, and number two, promoting lifestyle changes for patients, attendants, and human resource at the facility. And lastly, I'm sure that today's seminar will bring out many useful guidelines, and especially in the domain areas identified by the Ministry of Health and Family Welfare, Government of India, and the following concerns could be deliberated during the seminar. They are conscious lifestyle, patience, and human resource. Number one, active lifestyle. Number two, mental and social well-being. Number three, conscious lifestyle. And number four, traditional medicine. And lowering carbon emission in health facilities. Number one, energy conservation and climate resilience. Number two, waste treatment. And number three, paperless facilities. And number four, digital intervention. So, with these few words, I conclude my speech, and I wish the seminar a fruitful and a grand success. Thank you.
Dr. S. Priyakumar Singh gave a historic perspective of climate changes which has been highlighted as back in 1978 when scientists found ice melting in Antarctica. He also explained the importance of monsoon which affected food grain production and is greatly affected by climate distribution. Dr. Priyakumar also advocated the use of telemedicine in a state like Manipur.
Of sudden melting of large quantity of icebergs in an unprecedented way, because they are doing research on ozone hole near Australia in the Antarctic region. But they found huge melting of ice cap in Antarctic region, thereby showing increase in temperature globally. Globally, into 10 to the power 9 cubic tons of carbon dioxide emission. But there are systems which sink or absorb carbon dioxide. So which absorb is around 30 into 10 to the power 9. Zero carbon emission and man-made tragedy. ꯍꯣꯠꯅꯁꯤ ꯍꯥꯏꯕꯒꯤ ꯑꯦꯇꯦꯝꯅꯦ low pressure area wind start flowing aduna temperature rise tarpai se mafam amada mafam du low pressure oineba nusi keneba asan tawdana monsoon na chingwa ability of telemedicine because when African countries invaded by various diseases through telemedicine from America, the disease treatment is done in Africa by junior doctors. This can be attended here also in some far-flung remote hospitals where a junior doctor sitting there. Here you may have a studio with 3 or 4 doctors sitting for 2 hours per day and then video conferencing and showing.
Dr. Koijam Manibhushan echoed that there is no planet B and that climate change is for real affecting every region of the world, and they said that climate variability and change have now become global environmental concern today. He highlighted the factors contributing to climate changes for urban heat, runoff precipitation, and blanket of pollution. He advocated the use of solar energy and waste management at RIMS.
For a seasonal plants like a poppy for many users that about the drugs preparation and all. So that is one problem we are facing right now. So massive aduna and the solar energy is a must since we all have. And another one is a treatment of a wastewater coming out from your RIMS, even say, and necessarily you can even remove all the heavy metals if there is in the chemicals used by your RIMS. It can be treated. So wastewater treatment plant is also a very much required for the institutes like RIMS. So I think I have taken a lot of time. Say the temperature, like a team of scientists from Indian Institute of Science and a group have projected that the temperature that will increase in the have increased in the last century, and it will rise by 1 or 2 centigrade by 2050 and 3 to 4 degrees Celsius 2100 years in India. So similarly, if you see the precipitation will also increase by 10% with the increased variability causing the floods and the droughts. And this is the picture. This is the so the right one is in Mumbai that I have taken it from the clipping, and then this is in Uttarakhand during the say high reversing say we have certain impacts in several sectors, you see, like in agriculture, water, and
Professor Dr. Bumkim Oinam, while highlighting a case study of 2018-20 by his team, found that the concentration of health services is mainly at the radius of 4.7 kilometers in Manipur and is the line between the Imphal East and West districts. He stressed that even Imphal city, the state of ultimate climate change is visible. He explained the difference between the climate and weather by saying that the climate is what we expect and the weather is what we experience, whereas simplifying the very concept of climate change to general people. He presented strategies for decarbonizing the healthcare sector by net zero emissions, building design, sustaining water, sustaining water waste and transport management, better management of anesthetic gases with high global warming potential, use of telemedicine and digital health technologies, low carbon procedure chain.
Morning to all of you. First of all, I would like to thank the organizing committee of this Swachh Bharat, Carbon Sanya Bharat, for inviting me here at RIMS to give a lecture and technical talks on public health care facilities, basically in Manipur. And what are the, let's say, RIMS or Langol area, there will be rainfall. But if you go towards Manipur University, there will be no rain at all. So that this kinds of erratic nature of rainfall we could find at the local level also. That is what we observed since the last almost 3-4 years. They are adequate or not, and in which district, and in a particular district, let's say if we have different public health facilities like primary health centers, community health centers, so we look into whether they are sufficient enough to cover up the total populations residing in that area. A lot about our earth system. It's a very interconnected. If you see air, ice, land, life, and water, these are all very interconnected system. It's a very complex system that we need to look into it. We cannot study independently. We have to study, as a total, as a whole system, earth system science, we call it. So fundamentally, we also need to understand when we talk about climate change, nowadays every day we are facing different weather systems. So what is the basic difference between the climate and the weather? So we need to let our kids and our students, we need them to understand what is the basic difference between climate and weather. So climate is what we expect and the weather is what we get. So climate will tell us, means what kinds of clothes we need to buy. But weather will tell us what kinds of clothes do we need to wear. So that is the basic fundamental things that we need to understand. They do suggest that 30 years is the minimum, it's a standard time span for to understand whether a particular climate, let's say the trend has been changed or shifted. This is very important to understand. And based on that, we have different climatic zones like tropical, polar, Mediterranean, and 3-4 decades. Now, what is basically climate change? So when where we have an unusually bad weather conditions, so the questions arise whether is it due to global warming is to be blamed because of these changes in the weather. Because in